Hi, my name is Michael Benefield. This is my assessment of the anterior chest and posterior chest. This is for Albany State University BSN program. So we're going to start with the anterior chest. First thing I want to do is I want to inspect respirations, respiratory rate, make sure that they have symmetry in their respirations, noting any lesions, any bulging, any pulsations. I want to palpate for tactile thermitis. So I'll start up top and I'll ask the patient to repeat the words 99. So they'll say 99, I'll move down, 99, and lastly, 99. After this, I want to palpate for any lumps or any tenderness. So I'll start palpating from one side to the other, noting any tenderness upon palpation. From here, we want to percuss the lung fields, and so we'll do it in a coordinated fashion, starting from the top. Okay. Following percussion, we're going to listen to the lungs, and so we'll do the same systematic fashion, listening to the lung fields. Using the diaphragm, take a deep breath, 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 and deep breath. Following that, I'll get the patient to lean forward. And when they lean forward, I want to auscultate for heart tones, noting the rate and regularity of it. After we have assessed that, the next thing that we want to do on the anterior side is we want to assess for mobility in his arms. And so, starting at the wrist, I'll have the patients extend their arms and they'll flex their wrist up and down. We'll move on to having him raise his arms out in front of him, then to the side, up, over behind his head, and lastly, we will palpate for nodes in his epitrochlear region, and then we'll do that on both sides. Moving on to the posterior portion of the chest, looking at the back side, we would inspect, I want to look at skin, I want to look at configuration, I'm looking for symmetry, noting any lesions, any bulges. I want to take and I want to palpate his chest expansion from both sides. So I would have my patient turned over, but I would palpate and mark on both sides. I want to palpate for tactile thermitis also. So starting on his shoulders, I would place my hands on the posterior portion of his shoulders and have him repeat 99. Following this, I would start with looking for any lumps, any tenderness, any lesions, and I would palpate his sinus process. So moving down the spinous process, we would palpate all the way down, noting any tenderness, any lumps, any lesions, any pain upon palpation. Next, we want to start by tapping on the costovertebral angle to see if he has any tenderness. And we'll repeat that on both sides of the patient. Okay. We want to percuss the lung fields in the back, so I would have my patient flipped over, and again, I would percuss in a symmetrical fashion on the back side. And then also on the lower border of the lung bases, we would also percuss the same thing too on the lower borders. Moving on to the next portion, we want to measure for diaphragmatic excursion, and so we would take our ruler and we would start by placing our hands on either side. We would mark on inhalation, mark on exhalation, and make sure that that is maintained. Lastly, we want to listen to lung sounds. So I know my patient is facing anteriorly, but posteriorly we'd move in a systemic fashion, and we would do the same thing again, moving from top to bottom using the diaphragm of the stethoscope. We would move across the lung fields. Noting any adventitious sounds. And that's the conclusion of the posterior and anterior chest assessment.